Hello, my name is Juliana La Madrid, and this is my community needs assessment presentation. So the purpose of this presentation is to look at families within child welfare system and reasons why they come back. So the recidivism rates within child welfare. Um, Additionally, complicating factors that bring them into child welfare, ways that we could continue to reduce abuse and neglect, and identifying why children are brought in multiple times. I do work for child welfare services, so I have a big passion for this project, and it is something that I have seen throughout the time being at child welfare system as a big need. So the data collection process was I was able to interview two people over the phone, and one interview was via email because she was unable to speak over the phone. I did some online research, and the people that I interviewed were social workers. Two of them are social workers, supervisors in San Diego County Health and Human Services Agency, and one was an attorney from Child Welfare Services who represents the agency. And the agency will be used interchangeably between child welfare. So the participants were San Diego County Council. She has worked there for 3 years, and she is an attorney that represents the Health and Human Services Agency, and she educates protective services workers on dependency law and speaks on their behalf in court. Another one was a supervisor from the court intervention unit who has 14 years experience in child welfare services as a supervisor. His role is to work with families that have recently become involved with child welfare and have had their children removed from the parents' or guardians' care. In his unit, he assesses the needs of the parents and children and provides the family with services in order to address the protective issues that resulted in the agency's involvement in hopes of reunifying the family within the statutory timeframes. The last person I interviewed was another supervisor from the continuing services unit. She's had 16 years experience at child welfare and 5 years as a supervisor. I supervise a team of protective services workers who work with families to reunite with their children, along with continuing to assess for risk and safety of our foster youth. So some of the online research that I found was that disproportionately, children of color are more likely to enter the system, as well as there is a number of subsequent entries into child welfare system has increased. This is specifically within San Diego County. Also, there is a correlation between people receiving government entitlements and the involvement with child welfare. This kind of goes hands in hand with the children of color disproportionately being involved in child welfare, kind of where there is the culture of poverty and those types of things that are complicating factors for families, such as having no income, low income, lack of resources, and whatnot. Some of the interview findings were that there's a lack of community support and involvement, meaning that there's not people in the community that could really support our families after the agency leaves their life. Also, a lack of resources. So when child welfare is in their life, they have a lot of resources provided to them. And then when we step out, the resources are gone because they're no longer with us. So that's something that's been noticed. Also, social workers have a large caseload and it's hard to manage. So sometimes not being able to really build that time to work with your clients, build that rapport, have them gain that independence and confidence that they could be a parent is something that some social workers just don't have the time to do because they have too much going on, too much of a caseload, too much of a demand. Also, a history of trauma. Having child welfare in your life is very traumatic as is. And typically a traumatic event is what led up to having the agency's involvement. So without the unaddressed trauma, there could continue to be a cycle of abuse and neglect for children if it's not addressed. Trauma also could be intergenerational, where there's multiple family members who've had trauma and it just keeps on passing along through the family. Some of the recommendations would be to connect with community partners. So that would mean having the agency work with people in the community so that they could have that network outside of child welfare once the agency steps out of their life. Also ensuring that clients have a strong safety network. As social workers, we could do that while we are working with the families, making sure that they have those natural supports that are going to be there to kind of check in on them and make sure that they're holding them accountable, people who they could trust and that they allow them to be in their life. Also having more staff. More staff is an inevitable thing just so the caseload could be lower and so that we are able to really work with families to address the issues. And then having families learn that they could break the cycle of poverty, break the cycle of being within the child welfare system, having them learn that and might help them to be able to actually break that cycle so that their children don't become involved once they have children, and so on and so on. Some of the ways I could share these findings are via email. I could send this presentation out to supervisors and county council that I have interviewed. Additionally, I could present this presentation among my peers at work. There's opportunity for me to actually present a presentation such as this at the end of the year, and that might be something that I will do if I'm able to kind of build those connections with the community. Some of my reflections are that the key factors that were successful is that I do work for child welfare. So I was able to directly speak to supervisors within the agency, along with county council members and people that I normally work with on a day-to-day basis. I was also prepared with a list of questions for my interview, so that made it really helpful knowing what I was going to ask beforehand before interviewing my participants. Some of the factors that were a little hindering were that some of the outside providers did not respond. I tried to get some other perspectives from other people that I work with, but they didn't respond, and that's totally okay. And I could have explored other people to interview for different perspectives, but I didn't. I kind of stuck with what I knew, and I kind of just found that the people that I did interview did have a good point of view and good perspective on what I needed to have. Some of the things I learned is that there are definite flaws within the system. There is obviously some reason why families keep on coming back, why there keeps on being referrals, why their children continue to be abused and neglected, that the agency just isn't addressing. So something that needs to be further looked into. Also, there needs to be a sense of community. That community needs to be there for families, especially when they're in the child welfare system. Kind of like that saying, it takes a village to raise a child. It really does, especially for our clients who don't have anybody. So having them build that, those people within the community can ultimately help them out to be successful. And that is it. Thank you so much for listening to my presentation. It's been an amazing semester. And here are my resources.